Welcome in, guys. My name is Michael, and I'm going to give you a presentation on autism gaps. Let's get to it, shall we? The DSM-5 is used to diagnose an array of different spectrum disorders, and it is classified as persistent deficits in social communication and social interactions across multiple contexts and restricted repetitive patterns of behavior, interests, or activities. Autism acceptance is very, very important. As far as causes of ASD, the Autism Society says there's no single cause for autism spectrum disorder, okay? And people who have autism have the same range of needs and desires as other people and may need supports to fulfill those needs and desires. Very important. A few things that I want to cover. Covert and overt behaviors, okay? For autistic individuals, it's very hard to detect the covert, what they're internalizing inside. A lot of individuals that are autistic may be in flight or fight the entire day. They may get overstimulated by loud sounds, bright lights, many different things. So it's very hard to detect. It's very hard to understand. So I ask you to kindly consider these individuals because sometimes it's even hard for them to explain what they're going to, along with the cognitive communication issues that they also have. Developmental and behavioral screening should be done at 9 months, 18 months, or 30 months, or at any visit if parents or provider has concern, okay? ASD screening, 18 months, 24 months, or at any visit if parents or providers have a concern. Additional screening, if high risk for developmental delays or ASD, sibling or other family members have ASD, genetic or chromosomal conditions, okay? Complications at birth, being born to elder parents, preterm or lower birth weight, or the presence of behaviors associated with ASD. This is very important. The screening process is very important. Many individuals go undiagnosed for the vast majority of their life, even into adulthood. It's becoming very, very common. And this happens because of shame, because parents don't want to deal with the fact that their child may be on the spectrum. Many different reasons why. It could also be a lack of resources, not being able to have access to a provider that can adequately diagnose the individual or child, so they could get the support that they need. Early intervention is very important. Early intervention services are provided by every state for children up to the age of 3. And then these are also provided through school resources as well. So it's important that once you have your child diagnosed, that you follow with along with early intervention and an IEP with the school district, so the child gets adequate care. Okay. Autism and empathy is very important. A lot of individuals that are neurotypical, they come across a neurodivergent individual and they'll think that the neurodivergent individual is not empathetic, and that's not the case. Neurodivergent individuals have processing delays. They also don't know how to communicate as effectively as a neurotypical individual. And it will seem like they lack empathy, but it's actually quite opposite to that, because many autistic people report experiencing a heightened reaction of empathy called hyper empathy to others' emotions, which can be overwhelming. So they get overwhelmed, and kind of it's like a deer in headlight kind of like stance, especially when they're trying to process things that other individuals may process and move along. Don't judge what you can't see. Autistic behaviors are commonly misunderstood because autistic people have social and communication differences. This means that when someone guesses on an autistic person's internal state based on what they see externally, they are less likely to guess correctly because the state may differ from what they expect. An autistic person may feel one way, but appear differently to another person. Touching based on what we just discussed, this kind of sums it all up. About 1 in 44 American children have autism. And unfortunately, many of these children don't get early diagnosis, which helps them function better with this developmental disorder. Here's a look at some of the common reasons why the diagnosis is sometimes late. These are the 5 most common reasons as to why it goes undetected or undiagnosed. Exhibiting few signs early, widely varying symptoms, socioeconomic factors, parental denial or shame, very, very big one. And the last one, which is the most, wait and see attitude. You don't want to wait. You want to get your child diagnosed, or whoever the individual may be, because like I said, it could be somebody that's already an adult and never got a diagnosis. You want the diagnosis so the individual can get the resources and the care that they need so they're able to thrive in life. Autism Speaks, yay! So autismspeaks.org is a foundation that helps individuals with autism with resources and an array of different other things that anybody that's autistic may need. If you are on the spectrum and you need any help, you need help finding providers or anything at all, the website is listed here. It is a hyperlink, and their mission is it speaks clearly. Autism Speaks is dedicated to creating an inclusive world of all individuals with autism throughout their lifespan. Very important. We do this through advocacy services, supports research and innovation, and advances the care for autistic individuals and their families. Thank you, Autism Speaks. Thank you very much. This is my works cited page, and I want to thank you for joining me today on my presentation on autism gaps. If you have any questions, concerns, anything at all, please feel free to reach out to me. Yay!